I'm Tony, and I have progressive supranuclear palsy. Follow me on my journey.
Welcome to our video. Because of Tony's working memory problems with PSP, we're going to present this video a little bit different by asking Tony questions about his journey. First question: what is a clinical diagnosis, and why is PSP a clinical diagnosis?
Thank you, Barbara. In another session, I will discuss what working memory problems are. But let's just say for right now that my working memory doesn't allow me to remember much about the beginning of the questions. So just so people know, Barbara is saying them, but I've also got them written down. This is my normal voice. This is what Barbara has to listen to when I'm way in the back. So I just wanted to get that out of the way. I will be trying to use a loud voice from this point. But it is more tiring. So, what is a clinical diagnosis? And why is PSP a clinical diagnosis? Well, a clinical diagnosis means that there is no definitive test that can point to and say this is clearly the disease or whatever. The clinical diagnosis is made by ruling out some things and narrowing down what it could be. Your doctor will probably say that you have possible or probable PSP or CBD or whatever neurodegenerative disease. There are very few neurodegenerative diseases where we have definitive answers. Most will come when they do an autopsy on your brain if you donate your brain. Otherwise, you will just have that diagnosis. The closest that they can get to a confirmed is without the autopsy is called probable. I have a probable PSP or Richardson syndrome. So the second part, why is PSP a clinical diagnosis? Well, like I just said, what a clinical diagnosis is, PSP has no definitive status. You may hear people talk about the hummingbird or the hummingbird sign, or another one called the Mickey Mouse sign or morning glory sign, which are the same. Those signs will show up on the MRI in some patients, not all. What those signs are is an atrophy of your midbrain, and when it atrophies, it will give the look of the head of a hummingbird with the beak, or it will, from top down, look like the Mickey Mouse icon, the circle with the two ears, also called a morning glory sign. Those are close and pretty much definite that you have PSP if those show up. But as I said, they don't show up on everybody. Because they don't show up on everybody, that is why things have to be called a clinical diagnosis for PSP. They rule out various things. The types of tests that they may do are thyroid or some DNA markers for some things. Like vitamin B12 can mimic PSP if you have a shortage of that. And I think I mentioned thyroid, but there are a myriad of other diseases that can mimic PSP, and most of these neurodegenerative diseases overlap. So there will be signs on one and the same sign on another.
What are the signs for PSP, Richardson syndrome, which you have? And are there other variants?
The signs for PSP or Richardson syndrome, which I have, is generally, not always, start in this order, but generally is noted balance issues or backwards false. The next thing is sometimes cognitive issues, word finding. You may find that a person has had some changes to their not thought processes, but their overall demeanor. They may become more angry or even just the opposite. The other things for the Richardson syndrome, and that is another key feature of PSP, is that supranuclear gaze palsy. That means that it is above the nucleus in your midbrain. The palsy, of course, is like a paralysis. So what happens is that you have the inability to look up and down. Now, as we age, we tend to lose the ability to look up, to move our eyes as high as what we used to. The palsy part that is significant for PSP is that inability to move our eyes down. You can't see it, but I'm looking down right now, and I'm in a chair, and I can't see my knees. I can feel my knees, but by staring straight and moving my eyes down, I can only see at about 40 degrees down, or from the 90 down. I can't see that well, and so that is a common marker to show that it is progressive supranuclear palsy, and it is key features for Richardson syndrome. Now, there are some other variants of progressive supranuclear palsy. The second most common is the PSP-P, and that P, that second P, or that third P, stands for Parkinsonism. So that would be somebody who may early on have had tremors I'm exaggerating. I don't know how they actually do it. I don't have tremors. But the tremors may be seen early on. And that is the tremors generally occur when you're moving your hands versus when they're at rest, like by your side. Parkinson's generally has tremors when they're at rest, but are fine moving their hands. Those are generalities. The next most common is PSP-C, and that is cortical basal degeneration. So with Richardson syndrome and most of the other variants, you have a midline stiffness to your muscles and stuff. And I say midline, it would be equal on both hands for that stiffness, and equal down my legs. With CBD, they may be more stiff than on the other. They also may have what's called alien limb, which would make it look more like CBD, cortical basal degeneration. And the alien limb, their hand would move and stuff on its own. The person's not even thinking about moving it. It just does its own thing. That's just an example. That shouldn't be confused with freezing, and I'll get to that here in a minute. Starting with the PSP gait freezing, or PAGF is its initials. That you're primarily started with gait freezing before you had a backward falls. The gait freezing, and I do experience gait freezing, but these started later. The gait freezing, the way that it affects me is if I try to do multiple things at the same time, such as stand and turn, or stand and take a step at the same time, then my feet don't move. If I stand and stay that way for a few seconds and then take a step, I'm generally fine. But there are times that doesn't happen. So think about when you're walking. As you pass through a doorway, normally you'll turn left or right in a hallway or whatever. With gait freezing, you will your feet will freeze because you're moving and trying to turn, and your feet don't want to do that. So there's that version. And another version of PSP is a frontotemporal dementia version, PSP-FTD. The frontotemporal dementia we generally all get later. It starts off with that cognitive impairment, and it goes from there. With the FTD version, that is the first thing before your falls. So you start having the mental slowdowns, and we're finding issues. We're finding, but you generally start having the emotional, whether you're getting angry, and all the rest of this before you start your backwards falls. Later, they all tend to morph, all these variants of PSP tend to morph into matching more like the Richardson syndrome. The tremors tend to go away, not always. The gait freezing continues, but the other things catch up. The frontotemporal dementia continues, but you start with your backwards falls and vertical gaze and all of that. And that is basically the majority of the variants. But just like all of these neurodegenerative diseases, there is some overlap.
What type of symptoms, ancillary dysfunctions, may we see as the diseases progress?
As the disease progresses, you will see various symptoms continue and move forward. And this is not a comprehensive list, but some of the things that you will notice is slowing of the speech patterns, slurring of the speech. You will, as a patient, you will produce more mucus and phlegm, especially when you're eating, and that is an uncomfortable feeling. You will start to cough and choke on food as your swallowing is affected. You will drool, and you'll see me wiping the corners of my mouth because I do drool. You'll experience eye problems. Even right now, I'm sitting here. My left eye doesn't want to open. I can push it up, and then I can blink. You'll see me push my eyelids open. I've told you about the gait freezing. You can experience that gait freezing. I experience it. It started with my feet. Now my hands grip things, and they freeze, and they don't want to let go. I haven't figured out if there's two things involved like it is with my gait freezing, but I grab something and my brain doesn't say let go. The neighbors across the street have seen me trying to leave my house and grabbing the door frame to help steady myself, and my hand doesn't let go, and they see me or have heard me yelling at my hand to let go. There's nobody around. It's only my hand. My wife is already moving out a little bit. Some people find relief with massages and stuff. We haven't really tried that, but for me, it's time. But I think that's also why the eyelids freeze. It's that same kind of thing where it's freezing, and time will release it for the most part. One of the other things of which, and I'll talk about it in a future video more in depth, but one of the other things that you may experience, a good portion of us experience, is a executive function dementia. this dementia is not the same as Alzheimer's. But as with any other dementia, some part of memory is not working correctly.
What is the expected outcome?
And so the expected outcome, there's only one outcome, and this is the hard part of this, the tough talk. And that expected outcome is an earlier than normal death. You will need to come to terms with that on your own, because a general lifespan of a person is listed as 6 to 9 years after your first backwards falls. Now, somebody who has one of those variants, they will actually have a longer lifespan by a little bit, because it's based upon their first backwards falls. So people like myself with Richardson syndrome, the most common, fall in that 6 to 9 years. Let's say that I had that gait freezing for 2 years before. Well, you add that on to the 6 to 9 years. And that would be the general outlook. That said, there are some that are very quick in their brain going down, or they might fall, traumatically. So they fall earlier than that 6 to 9 years. But there have also been some with PSP that have lived upwards of 20 years. Generally, the medical community does not say that you died of PSP. You can ask for it to be noted on the death certificates and things like this that they have PSP, but generally it is listed that you had aspiration pneumonia. Well, you aspirated, you've got this stuff down in your lungs, the food and water, because the PSP damaged your swallowing. The second most common, other than aspiration pneumonia, is falls. Falls forward, falls backward, it doesn't matter. It's false. You need to protect your head as much as possible, and your neck and stuff. But that will be listed in the death certificate for some people, even though the PSP caused their issues. They still list it as false. That's the medical side of things. But those that is really a tough question. I can talk a little bit more freely about it myself because it is tiring me out. I can talk about it more freely for myself because I have known about my diagnosis since 2019, and I have come to terms in knowing that this is going to happen. Some caregivers don't tell the patient, and some patients don't want to know. But for those watching the video, this is the answer to the toughest question on here.
Are there any available treatments?
Unfortunately, there aren't any available treatments which will slow the progression or stop the progression. There's always hope. But currently, as of this recording in April of 2021, there isn't any. Now, that said, there are treatments that help you use what you have or make you more comfortable. For instance, a lot of patients will be put on carbidopa levodopa. Brand name is Cinemet. They will be put on that with some increasing dosage to try to maintain some mobility and less rigidity through that. Other things that are tried if they have sleep issues, those of course sleeping medications. There's several different medications which will alleviate some of the drooling. I really only drool whenever I talk a lot, for the most part, but I do drool. For the mucus and stuff, there's several other things that can be given. For the mucus and stuff, I myself have been given a nasal spray. I'm still fairly early on, and it works for me. There are more things that can be given for any pain that you feel, along the way. And there's also treatments for your eyes. My eyelids close, as I've noted. They can put Botox injection. The thing about those is that you will only be semi-free of those for just a couple months. Generally, you've started back again before your time for your next injection. The moving your eyes up and down is still going to be there, but they can give you prism glasses to help you see down lower. Another thing that people do is they'll put an eye patch or a tape over a lens. That also helps with some of the double vision. I have a double vision. I see my eyes don't always come together at the same speed to the same point, but each eye also has a double vision. I have two images, one on top of another, so I basically can see four images. Covering it up will still have me double vision, but it'll only be two images. And that is a focus thing on my eyes. It's where it's focusing. There are other treatments to help. One, to help keep mobility. One thing is some physical therapy, or just to keep moving. The thing that helps a lot is this big and loud program that Parkinson's people have or use, and that gives you, teaches you to project your voice, which is what I'm doing now. because, as I've said, this is my normal voice. It's a lot lower than me talking for this video. It doesn't wear me out as much, too. But with this projection, we've also got big movements, big exercises where you're trying to do it all. Some can do it while they're standing. Others have to do them while they're seated. I'm to the seated point. There's also rock steady boxing that can do that as well.
Thank you for joining us on this video, and the next video that we're going to do is going to be called Playing to a Different Tune. Thank you, and remember to make memories.